Oxygen therapy is often seen as a simple intervention. A patient looks short of breath, oxygen is applied, and the task feels complete. But in nursing practice, oxygen therapy is never just about turning on a flow meter. It is about understanding what the patient's body is struggling to do. Welcome to the Learning Studio, where we don't just teach theory, we show how knowledge turns into real-world understanding. Many students think oxygen is harmless and can be given freely whenever a patient looks uncomfortable. In reality, oxygen is a medication. Like any medication, it has indications, correct dosing, and potential risks. Respiratory nursing exists to ensure oxygen supports the body without causing additional harm. Think of breathing like a supply chain. Oxygen must enter the lungs, cross into the blood, and reach the tissues. If any part of this chain is disrupted, the body begins to struggle. Oxygen therapy helps, but only when the underlying problem is recognized and monitored. At the bedside, nurses assess more than oxygen saturation. They observe respiratory rate, depth, effort, and pattern. Use of accessory muscles, nasal flaring, and changes in mental status often appear before oxygen levels drop. These signs tell nurses that the body is working harder to breathe. Different oxygen delivery devices serve different purposes. A nasal cannula supports mild hypoxia. A simple mask delivers higher concentrations. Non-rebreather masks are used when rapid correction is needed. Choosing the right device depends on patient condition, not convenience. In respiratory nursing, understanding chronic versus acute conditions matters. Patients with long-standing respiratory disease may tolerate lower oxygen levels and respond differently to therapy. Nurses adjust oxygen carefully, monitor closely, and reassess frequently to avoid complications. Across healthcare settings, respiratory compromise is a common cause of deterioration. Early recognition by nurses prevents progression to respiratory failure. Monitoring trends, not single values, allows timely escalation of care. The nclex tests oxygen therapy by focusing on assessment and prioritization. Questions often ask which patient needs oxygen first, or which finding indicates worsening respiratory status. The correct answer is usually the one that supports breathing and prevents hypoxia. In real practice, respiratory nursing is continuous. Nurses reassess after oxygen is applied, monitor for improvement or decline, and communicate changes promptly. Oxygen therapy is not a one-time action. It is an ongoing process of observation and adjustment. Now that you understand oxygen therapy as a clinical decision rather than a simple task, the next step is learning how nurses manage skin integrity and wound healing, where circulation, oxygen, and tissue health intersect. That connection becomes clear in wound care practice, and that's exactly where we'll go next here at the Learning Studio.